As I was getting ready for our conversation today, I was being reminded of those changes and how they affect each other, right? So you've got this challenge with regulating insulin, which is critically important. And then you start to have these fluctuations, okay? And then that's just perimenopause. Then there's the transition into menopause where things can really go up and down. I call that the stock market phase. Up, down, okay? And that can really be, then we got another roller coaster, literally. And then women are coming out on the other side of that in menopause. So I 100% agree with you. The more things that a woman with type 1 can dial in before these fluctuations, I mean, women go through fluctuations all the time. We have our cycle, we're fluctuating every day. So it really is a true challenge. But the more with lifestyle, sleep, eating, obviously, for sure, that's a lifetime challenge for all of us. But I think for sure, especially with type 1 in that setting.
Hello and welcome to this week's episode of the Type 1 and Midlife podcast. I'm your host, Melissa Slepp. I was diagnosed with type 1 diabetes at 14 years old and now founder and CEO of Abundant Health with Melissa. And as a certified health coach, I know the unique challenges of managing diabetes in midlife and beyond. So I've created a coaching model that has empowered hundreds of women to thrive despite their diagnosis. And each week, I'll bring you conversations and strategies with guest experts, along with insights from my own 40-plus years of living with type 1 diabetes. I'll also share how my faith empowers me both emotionally and helps me to navigate the daily challenges. So if you're a woman ready to redefine your diabetes journey, this podcast is for you. So before we dive in, remember this podcast isn't a substitute for personalized medical advice. Always consult with your physician or medical professional before making any changes to your diet, insulin dosages, or healthcare plan. Well, hello and welcome to today's episode 69. We are thrilled to have Dr. Liz Lyster. She is an OBGYN best-selling author and renowned speaker joining us. Dr. Liz, who runs a private practice in the San Francisco Bay Area, specializes in perimenopause and menopause, helping women and men in midlife lose weight, boost energy, and reclaim their vitality. And Dr. Liz is not just a medical expert, but also a living example of vitality. She celebrated her 50th birthday by climbing Mount Kilimanjaro. Pretty impressive. And with a background from Cornell University, UC Irvine, and UCLA, Dr. Liz combines extensive medical knowledge with a passion for empowering us women through menopause. And in today's episode, we dive into the main physical and emotional challenges of perimenopause and all the way into postmenopause, the gaps in Western medicine's approach to these stages, especially for women with diabetes, the role of community in easing menopausal transitions, and common misconceptions about menopause, hormone replacement, and how to distinguish symptoms from other health issues. We discussed the impact of lifestyle changes and personalized wellness strategies as well, and how important it is to find supportive healthcare providers and managing feelings of isolation or anxiety as we're, transitioning through this time of life. And we'll also discuss hormone restoration, better known as replacement, but today we term it as replenishment and restoration, and what it involves, and who benefits from it, and who should avoid it. Plus, Dr. Liz will share insights on how the Miracle of Menopause Network supports its members and some inspiring success stories. So tune in to learn more about how to navigate this life stage with confidence and with diabetes, and to wrap our arms around lots of support. So let's get started. Hope you enjoy the show. Well, hello. Welcome to the show today. Today, I am so happy to introduce Dr. Liz Lyster. Welcome.
Thank you so much. Happy to be here.
Yeah, great to meet you. And we definitely have a lot of similar things that we are talking about and sharing with our audiences. And let's start with you, just to get to know you a little bit more. We all tend to, we all have a story. There's a reason we do what we do. So let's start with your journey and what has led you to where you are with women's healthcare and what inspired you to focus on specifically perimenopause into menopause.
Yes, absolutely. I would say that the journey, it probably started sooner, but because in college I volunteered at the women's health clinic. So that was already a little bit of an interest developing. I loved the education that was conveyed in that clinic. A lot of time spent talking and teaching. So that was definitely an early influence. And even before that is my mom, who's now in her late 80s, and she is retired from being a pediatrician. So I had that background. And my dad as well was a doctor. He's retired from being a neurologist. So I definitely had that background.
Mm-hmm.
In medical school, I had a very influential experience following the chief resident into the patient's room. And the patient, she was having problems related to menopause. That's all I remember. And I don't remember what we did for her, but what I do remember is that she felt so much better just after talking with us. Well, probably not with me. I probably stood in the corner and just observed the entire thing, but talking with the doctor. And that really stuck with me. Then, sure enough, I chose OBGYN. And over the years, I loved everything about it. However, I started narrowing things down. When I started to identify what I enjoyed the most, it turned out to be those conversations, speaking with women. So I let go of the baby delivering, which I really enjoyed, but babies tend to be up during the night. I prefer to sleep at night. So let that go. And then I kept narrowing things down, stopping the major surgeries and then the minor procedures. And finally, it was all what I do now, which is the consultation with mostly women. About 10% of my practice is men, so they're a lot of fun to help as well. They're more straightforward than we are, so that makes it fun. and I just love it. Love what I do. I get to talk with mostly women every day and help them feel their best.
I like that. You mentioned something, because you started off in the OB end of it. So obstetrics, gynecology. Yes. I mean, it's really the same field because it's the woman's female reproductive system. Yes. But it's interesting. When I don't remember the exact year, it's probably maybe 6-7 years ago, is when I decided to leave the OBGYN practice that I had been with here in my town for years. And because I realized I was in a different phase. And as wonderful they were wonderful working with new moms delivering babies. That was their specialty. Right. But what I was going into with perimenopause, and it was a different stage. So, and I know this is kind of a wide question, but wouldn't it be nice if we could have like an OBGYN/menopause doctor where it would be clear to those of us of, okay, this is my age. This is what I'm feeling. This is who I need to start to see now, just having that transition over. Yeah.
Yeah, exactly. Something as simple as when I go to my appointment, my doctor won't be out delivering a baby.
That as well. Yeah.
So Or just
to have that referral. And I didn't mean to interrupt, but just to have that referral from an OBGYN office that, okay, now it's time for you to transition over, here's a good practice, if we can't help you here. I know this is just a tangent that I'm just thinking about, because I think it's a good indication of what's missing in our healthcare system. and the lack of knowledge with hormones specifically.
Yes.
So, and this is obviously something you specialize in. We need to clone women like you that are in the medical field that are helping us. So can you explain the main physical and emotional challenges women face? And you touched on this when you noticed this as a young lady witnessing, because we want to be validated for all these changes. We don't want it to be dismissed. Right. We want to be heard. So this is something that you're able to kind of fill that. Yeah.
Yes. And unfortunately, it's all too common right now. I've been a doctor through the rise and the settling down of the kind of big box HMO setting of practicing medicine, and also seen things that my parents they've worked in a lot of different settings. So I've seen a lot of different scenarios, and you're absolutely right. At this point in time, doctors are in a hurry. They don't have a lot of time, and women going through perimenopause and menopause really need to be listened to. They need someone. Now, I like to also prepare women, take a checklist, maybe take somebody else to come with you if necessary, depending on how well you think you can listen to what's going on. So really, really important. I always say, like, to be the tail that wags the dog and really kind of take charge of those few minutes with your doctor. Another thing that's happening right now, which is really unfortunate, and as I always say, I'm busy taking care of women, but at some point I do hope to turn more attention to working with other doctors and just giving them the basics. Because what we have right now is an entire generation of doctors trained under the Women's Health Initiative study that came out starting in 2002 and has just done the biggest disservice ever to the idea of replenishing hormones to help women feel their best through perimenopause and menopause. And so the data from that study was based on wrong women being studied, the wrong hormones being used. It was just based on so many wrongs. And now we've got this whole huge generation of doctors who they just heard that data. They didn't go back, read the study, find out the flaws. So women are up against that as well right now.
Yeah, most definitely. And I can relate to that. And this is something that we're talking more and more of on this show, because that's my mission here, because I continue to learn from doctors like you, not only meeting in person, within my own space here where I live, but some other amazing guests I've had on the show, all about spreading the truth, educating and supporting, and just guiding women in the right direction. And so guess what? When we have type 1 diabetes, can you just imagine what happens at that time of life? So can you speak into that as far as, and if you can maybe explain your process, and you've already pointed out how Western medicine is stuck. It's got that same sort of a dogma attitude about, the harm of hormones. And a lot of my listeners know I am an advocate. I am on hormone replacement therapy myself, big believer. And I don't push it, but I encourage it. Right. And I'm sure that's your stigma. It's just all about giving women the facts. Yes. Take a look. Forget about that WHI that was way out of whack back in the day. And, it's funny. I was just talking to my mom the other day. She was wrapped up in that. She was a little bit later on, but she was never put on hormone replacement either. She was on birth control in the earlier years. Again, that was to kind of mask the symptoms. But to this day, she's just still very disconnected from that. She's 80 now. So, and this is a side note, and this is not something that we can cover here today, but I often wonder if there's ever, if it's ever too late, even for somebody like my mom at that age. You can answer that now or later, or I know that's kind of went off on the rail a little bit there.
Yes.
But
yes. Well, my mom's in a similar situation. She had a hysterectomy in her 30s with her ovaries removed. Now that was a long time ago, a lot of things going on at that point in time with her health. However, she was then on her hormones, and then age 68, the average age for women developing breast cancer in menopause. So she was taken off of her hormones, and she's had all kinds of issues, particularly with her bones, since that time. And so officially, the answer to your question is there's no cutoff date. I was very pleased that the Menopause Society, which was formerly the North American Menopause Society, in their most recent position statement, took out that arbitrary cutoff. All right. So there's a lot more to talk about that is more specifically related to exactly what she may have going on.
Right.
For example, with my mom, do I think at this point that estrogen would help her? It's really hard to say.
Yeah.
She's now gone 18 years without it.
Yeah.
And she's lost so much height from vertebral fractures. And she like barely hits her arm. She'll stumble in her house over a charger cord or something and break something. And I, even though I too am definitely biased in favor of hormones, I say exactly the same thing. I'm not here to persuade women to use hormones, but I went into menopause when I was 43 and I'm getting ready to turn 60 next year. And I have tried all the different things out, you name it, patches, gels, creams, hormone pellets, lots of different ways to do that. So I'm definitely in favor of it because I'm in favor of women feeling good.
How about that?
Yeah. I don't want women to needlessly suffer. One of the things I always like to say is that if women, and then we can talk specifically women with type 1, because that's such a special scenario. Of course, obviously we need more research specifically in that setting. But there's a lot that we can share with your listeners. But it's just so important to understand that if you are not feeling good, if you're having hormonal imbalances, that using some of the right kinds of hormones does not commit you to use it forever. And I think that's very important for women to hear, so that, because a lot of women think, oh, well, I don't want to use it. I don't want to use it. I don't want to use it. And they wait till they feel absolutely horrible because they were thinking the whole time that if they started, that they would be stuck. And that's not the case.
That's interesting.
So I always like to say that.
Yeah. But hormones are something our body is used to thriving on. And there's different, I heard the term, and I'm not the one creating this, but instead of replacement, but it's replenishment. That's hormone replenishment, right?
Yes. That's so what I use too.
Yeah. Because we're living longer. We're doing more, we are, and this generation, we're doing more past the age of typical menopause. So why not feel good while we're here? Right. Why suffer? I don't understand why not. And another example, I heard somebody else say this. We have great conversations on this podcast. There was another guest that mentioned this. She said, but diabetes is an example. Insulin is a hormone. So if somebody told me, well, sorry, your pancreas doesn't work anymore, that hormone that is going to keep you functioning, because in theory, I guess we could live without pancreas, but really how long and how well? And thyroid is another example, that is a much needed hormone, again, that works together with all the other hormones of the body. So when we take a piece out of that that well-oiled machine, and suddenly we are taking a step back, our doctors are not going to tell us, hey, you've been on insulin too long, you don't need it anymore.
That's right.
I know that's an extreme case, but it's the same thing.
Yes,
it's a necessary.
I totally agree with you.
Yeah.
Yeah. That's exactly right. People wouldn't feel bad. People shouldn't feel bad about using what they need in order to get their body in balance when they have diabetes. They're not going to say, they're not going to consider, it's not like a weakness.
Right.
No, it's giving your body what it needs, and it's also allowing you to function. Another thing that goes along with what you're saying is how long we live now. Okay. 100, just over 100 years ago, for sure, 200 years ago, only about 5% of women reached age 50.
Right. That's what I've understood.
Right. And someone with type 1 diabetes, just, forget it. Right.
That's true.
that was
Mhm.
just not going to work out well at all. So
Yeah.
for many reasons, women in particular just didn't reach age 50. So living in perimenopause and menopause just wasn't something that many people saw. And
Yeah.
now we can expect to live much longer.
Yeah.
So how do we want to live? What kind of quality of life do we want? That's
Right.
important to keep in mind.
Absolutely. And it's so good that we're talking about it. We're saying the
Yep.
word out loud, right?
Yes.
So
Yeah.
how is this different? I share a lot of my own story about how my life turned upside down once my hormones were starting to drop. So as a doctor, if you could maybe put this into some sort of terms and all that kind of describes it. How is it different for those of us that are also managing type 1 diabetes, which is an autoimmune?
Sure, exactly. I was just about to say that. So definitely we can talk a lot about the hormones. So I think that's a good place to start. But let's also remember between us to address the autoimmune and how that impacts, right? Because women in general have are more often diagnosed with autoimmune issues. And I personally think because I see everything through a hormone lens, I think that the reason more women are diagnosed with autoimmune issues is because we're way more complicated from a hormonal standpoint, right? Boys go into puberty. Yes. Okay, fine. Their bodies start to make hormones, but girls going into puberty, oh my gosh, it's just a big roller coaster,
Right.
right? And then hopefully things settle down, right? People diagnosed young, childhood and teenage with type 1, that how's that for a massive wrench in the whole works,
Yeah,
right?
absolutely.
And then hopefully things settle down in a regular period for as long as possible. And then perimenopause and menopause. The first hormone that declines is progesterone. And that's typically as early as a woman's 30s, possibly earlier. There's so many hormonally disrupting elements in our world today, right? And certainly women with type 1 have that a little more teed up, ready to have some disruption, right?
Yeah.
So progesterone, and that calms the brain. So not having enough progesterone can result in anxiety, sleep issues. Those are really kind of the top ones that I like to put out there. Then I think for most women, at least when they get to their 40s, again, sometimes younger, that's when estrogen starts to fluctuate. So because there's less progesterone, maybe the cycle is not quite as regular. Then estrogen fluctuating, that can give headaches, breast tenderness, mood issues, and also disrupt sleep. All right. And then, of course, weight gain, and weight is a challenging issue for women overall through our whole life, right? Because of the hormones that are involved.
Yeah.
So I think that's a good starting place to keep that in mind. Yeah.
You
Talk all day
mentioned,
about it.
and something, and because I know estrogen and progesterone work hand in hand, right? They're
Yes.
sisters. I'll call them sisters.
Yes.
So, and I never realized, but it's making sense now that you just said this, that when the progesterone tends to be the one that's falling. And so is this why you're seeing more estrogen dominant diagnosis?
That's it.
Because that's what happens. Why. Progesterone's not holding its space, so estrogen gets over. So does it have anything to do? I guess it's like, is it the chicken or the egg? And we're not sure which one comes first.
Right.
I get it's lifestyle, it's environment. And I continue to encourage, a lot of the women that I work with, myself included, this is something I have to keep reminding myself, we have got to really dial in these lifestyle habits sooner than later. And consistency, not perfection, just consistency, good food, reducing stress, all those things that impact hormones, impact insulin, sensitivity, that in reflection impacts everything. It can be a vicious cycle when it gets out of sync. Yeah.
That's exactly right.
Yeah.
Yes. And that, as I was getting ready for our conversation today, I was being reminded of those changes and how they affect each other, right? So you've got this challenge with regulating insulin, which is critically important. And then you start to have these fluctuations, okay? And then that's just perimenopause. Then there's the transition into menopause where things can really go up and down. I call that the stock market phase. Up, down, up, down. Okay. And that can really be that. Then we got another roller coaster, literally. And then women are coming out on the other side of that in menopause. So I 100% agree with you. The more things that a woman with type 1 can dial in before these fluctuations. I mean, women go through fluctuations all the time. We have our cycle. We're fluctuating every day. So it really is a true challenge. But the more with lifestyle, sleep, eating, obviously, for sure, that's a lifetime challenge for all of us. But I think for sure, especially with type 1 in that setting, but also with sleep, we tend to be, especially women, we make fun of men when they actually sleep when they're tired.
Oh, that's so true.
Whereas what we could do is take a page out of their book and sleep when we're tired.
Right. Listen to the body for sure.
Exactly. Very, very important, because otherwise the doctor's going to give what I call a Band-Aid medicine. That's a sleeping pill. It's an antidepressant, which I'm not knocking those meds. They have their place. However, they're usually given as a Band-Aid for the symptom instead of looking at the root cause, what's happening hormonally.
Are you frustrated with your blood sugar and weight despite doing all the right things? Well, guess what? You're not alone. As a woman managing type 1 diabetes, I've been there too. In my late 40s, hormonal changes disrupted my blood sugar, my mood, and my waistline, and I felt unsupported by my doctors, but found the answers to regain balance. Thankful for that. And if you're worried about how diabetes will affect how you look and feel as you age, and if you're noticing muscle loss, brain fog, poor sleep, or overnight highs, I have a free assessment to identify the top reasons for the weight gain and blood sugar fluctuations with type 1 diabetes during perimenopause and beyond. And you don't have to navigate this alone. My proven 3-step process, which you will have access to, has helped countless women maintain stable weight and blood sugar into postmenopause. So just click the link in the show notes to take the free assessment now. Let's find balance together. I've been there and I'm here to help you every step of the way. Now back to the show. So what do you often see as misconceptions about menopause that you encounter?
Yeah. The most common one, I would say, is where the doctor said to my patient, because before they get to me, they've tried everything else usually. And that is, well, you're still having your period, so it can't be your hormones.
Okay, right.
And that is fatigue, weight gain, because even type 1 women can flip towards more insulin resistance. It's fascinating and so complex. I want to remember to say that estrogen, generally speaking, estrogen promotes fat burning and progesterone promotes fat storage. And it kind of makes sense. Progest. So it's in favor of pregnancy. That's what progesterone is for. And when a woman's body is making a new person, storing energy in our body is a great thing to do because we're making a whole other human being.
Yeah.
Okay, which is super amazing and a blessing. However, it's really something on the body. Okay, so, and we already talked about those fluctuations. And so women with type 1 have to just really be on the lookout, really. And like you said, God willing, find an endocrinologist who's going to go with that and who has some knowledge and not just be 100% focused only on the diabetes.
Yeah.
and
Or,
have an understanding of the context of what's going on. So that's definitely myth number one. Well, you're still having your period, so it can't be your hormones. Couldn't be further from the truth.
Yeah, it's just so amazing. You just mentioned insulin, because the endos are generally, our endocrinologists are just focused on that one hormone that they specialize in. Although the endocrine system, they should know it's connected to the reproductive system. The adrenals, all of it. Yeah, it's just amazing. Yeah,
I know. Gynos, reproductive endocrinology, that's a subspecialty of OBGYN. And maybe you and I are determining a future direction for medical subspecializing, because really there has to be convergence, because the reproductive endocrinologists, they're not focused on diabetes, hypothyroid. They're focused on, they do, obviously, all OB doctors who are taking care of women have an understanding and awareness, because we're trained with the ovaries as part of that hypothalamic pituitary axis, right? It goes to the thyroid, the adrenals, and the ovaries. But still, a lot of doctors they're just so focused, so subspecialized, even in endocrinology. I've had, I have patients, I address thyroid in 100% of the patients that I take care of. And I go into great detail with it. And then sometimes I'll have someone where I can help them get a lot of things balanced. I'm thinking of a particular patient of mine, but she has diabetes. She's like a true blue diabetic. And so I wanted someone to help with that. And it was tough. It was tough getting someone to look at the whole picture.
Yeah. And that's what I help women do. So yes, I'm called in by, I have a practitioner here in town that refers people to me. Beautiful. And it's really good, because it really is a team approach, because I come from that end. And I've lived through menopause too. How about that? I think the biggest thing I learned was when I was suddenly having to use so much insulin. And these are definitely some things I've shared on the show. And it was gradual. My resistance was more and more resistant. And I've been so dialed in with I'm pretty consistent with my routine. I just like to eat well, like to move a lot. Sleep is real important. So it's like, check the box. And then suddenly, it's not working anymore, and I'm putting on weight. My basal rate nearly doubled, which is just unbelievable. And then when you bring this to the doctor, they really don't know what to tell you. So I had to search my own great resources. I didn't know you at the time. I kind of wish I did, because obviously I would have put more of it together sooner. But I did. I was able to put that together and realize this is what was happening. That's when I took the step to pursue hormone replacement. And it took time, as you know, it takes time to dial it in, get the right dose and all of that. But within, I would say, less than a year, it was a gradual back to my norm, where I was back in balance, back to the, lost the weight, basal rates back to where it needs to be. There's hope out there.
Awesome. Because you talk about these things, you were aware, you were ready. That's beautiful.
Yeah. And that's what we need. I know support and community is real important to you as well. And, that's the best thing we can do. The doctors are there. They're amazing resources. They have the tools. But we need each other to bounce these things off of, and I think just to validate that we're not going crazy. And that, living with a chronic disease that, to this day has no cure, and then tackling on something else that's going to put another, it just added, it's 10 times worse. It just is. And it's not only physical, but it's emotional.
Absolutely. Absolutely. Everything we're talking about impacts the brain. Estrogen helps with mood. It helps depression. Progesterone, as I mentioned, helps calm the brain, helps with anxiety, helps with sleep. And there's really it's actually better when women introduce this hormone replenishment a little sooner. All right. It's a little more difficult, right? If a woman is completely in menopause, and that has happened, women have come to me who they felt okay during the transition into menopause, but then all of a sudden they didn't feel good at all. So that is kind of a more of a blank slate. We can introduce some hormones, very low dose, and work up from there. However, if a woman can introduce really, like I said, low dosing and also bioidentical, very important. The types of hormones that women use are just as important as everything else. Birth control pills are oral estrogen. We now know from that big study where those women were given oral estrogen that we're much better off using it through the skin. So a cream, a patch, even hormone pellets are okay. Obviously, depending on where she is during that transition into menopause.
Really good. Yes. Yeah. Thank you for
on top of it.
Yeah. And those are obviously questions that we both get asked, even at ladies that come to me and they're like, okay, so and one of the first questions is getting their levels checked. So obviously this is something that you work on, because you got to know where the foundation is, you got to know where they're starting. And even if they're still cycling, so like you say, if they're still, even if it's irregular cycling, they're still cycling. There's probably, I'm sure there's a strategy with how you do that, because it has to be at a certain time of their cycle in order to track.
Yes. Yeah. Well, again, I work with busy women. And so if I ever want some blood work done at a particular time of the cycle, I always use the phrase aim for that day of your cycle. Because if it's a choice between getting the testing done or not, just go get the testing done. I'll be able to figure it out as we go from the medical history in our conversation.
Right.
So that's the first step. I do 5 steps with women. The first is detecting symptoms that could have a hormonal basis. So we've mentioned a lot of those today, and you talked about that. The second is very detailed testing. So I would say in the category of difficulties that women face when they go to their doctor is getting enough testing.
Yeah.
Right. They'll do, an FSH test, FSH. That's great. That gives an idea. A lot of doctors, they're not even willing to do that, but sometimes at the woman's insistence, they'll run just a couple of tests.
Yeah.
Whereas I like to get a very thorough baseline panel. That's the second. The third is interpreting those results. Not just did you squeak into the bottom of the range, but what is an optimal place in that range? So that's the third. The fourth is bioidentical hormones. So similar to what your body used to make enough of. And now it's fluctuating, or maybe if you're completely in menopause, your ovaries are in full retirement. So so you are not making those hormones. And the fifth is, of course, the follow-up, the dialing things in. Okay. So that's the process that I take.
That's right on. I love that. Yeah. Yes. And that's definitely the process I went through as well. So how can women find the right healthcare provider to support all this? That's the magic question, right?
It's I'm going through this myself. We moved to a new area. I'm trying to find a new primary doctor. So what I share with patients is, for the gyno, is first you get the list of people that you can go see, and then you have to just have time on your hands and make the phone calls. How you're interacted with by the staff is important. You could find the best doctor, but if their staff don't return your calls, then you're going to end up not with the care that you need. So that's important. And then just making sure, and then doing what you can, like you said, basically you coach people to advocate for themselves. That's crucial. Show up with your questions, especially the embarrassing ones, right? Sexual function changes as we get into our, for sure, 40s and then 50s and better. So all those questions, and studies show that doctors are not great at bringing those topics up. They might say a quick question or two, but if that's something that's affecting your quality of life, put it on a list. I personally like people to tell me their list of questions at the beginning, right? Because if you have a list of 5 questions and you just ask the first question, your doctor may answer that question, might take 3-4 minutes. And then by the time you get to your third, well, I'm sorry, I don't have any more time today.
Right. Yeah. It's important to get that. Yeah. We definitely need to make use of that time for sure.
For sure.
Yeah. And our endos, I think it really does. This is a very case by case basis, whether or not we can even start with our endo. When a woman is starting, she's going through this phase where sometimes these symptoms can mirror each other. There's a lot of menopausal symptoms that can show up. The first thing I think of is hot flashes, poor sleep, weight gain. Those are things that can mirror blood sugar that is being, and this is actually the result of it. And a woman may not realize that, the one is pointing to the other. But I think that's where the confusion goes on, is that they're feeling all these different things, they're experiencing it. They're not sure which doctor to go to. It's like, okay, do I go to my endo? He's just going to tell me to take more insulin, or whatever. And, just to dial that in without really understanding the underlying reasons, which is what I share, my story, just to really, and advocating is so important. This is why it's so important for us to get this out there and to share and just to let people, I think, the number one thing is just, I have some younger ladies that come to me and, they'll say, well, I'm not quite there yet. I said, but stop and listen to what I have to share with you. Listen, I wish I had known this sooner. But put this in your back pocket, because this is really good information so that you can get through that stage, with a lot less pain and suffering and questions and frustration, all of that.
Yeah. And we've touched only briefly. I just want to give another little shout out to thyroid and adrenals. All right. Well, you were talking about the blood sugar challenges and how that really rose up with those other hormonal changes that were happening. And that is also very important. Cortisol production in women is very particular. It's different than what men experience. We have testosterone in our bodies. Just a little very quick shout out to testosterone, because that really can help women feel better. And it's often ignored by regular doctors, because there's no pharmaceutical way to give women a little bit more testosterone. It has to be through a compounding pharmacy, at least in the United States, at least for right now. And so, but thyroid and adrenals, so important, right? Then their cortisol release, and that's impacting blood sugar. Stress management, I know you help women with that as well. That's why it's so critical. It's truly that intimately connected to the whole endocrine system, all the balance and interaction. So people need to get that kind of support like they get from you.
Absolutely. I appreciate that. So like hormone therapy, is this something that is it absolute? I've got my own answer to this, but I'm not a doctor. I'm just coming from somebody who's enjoying being on my hormones and what a difference it's made. But is there anyone that it's not a fit for? Is there a woman that's not a fit for?
I suppose if I sat to imagine someone for whom no hormones would be necessary, like that woman should not be on absolutely anything hormonal. And now we're talking about the female hormones, right? The perimenopause, menopause, more of those changes.
Sure.
For example, well, I'll answer that in a couple of ways. But one thing I wanted to say briefly is the use of vaginal estrogen. In my book, there is, I can never say never in my line of work, but there's virtually never a scenario where a woman cannot use vaginal estrogen, whether it's a cream or a tablet. Those methods are in microgram dosing. They don't treat anything in the body. They only treat the vaginal lining. and the base of the bladder. Very important for diabetics to avoid bladder infections. All right. We have special anatomy and scenario and tendency already built in favor of bladder infections. And so a little bit of vaginal estrogen can help keep those tissues in good shape, help the pH balance, to just help women avoid those, not just infections. I'm not sure which is not just, but to avoid infection and to avoid discomfort. And to be able to keep up if someone's sexually active and wants to stay in those intimate relations with her partner, then because it's normal to not want to do something that's painful.
Right.
So when women talk with me about low libido, okay, well, first let's talk about what's happening physically, anatomically. So that's really important. Then there's systemic. And I am a big fan. I do think, you're a living testimony to getting the hormones in balance helped your blood sugar get back in balance.
Yeah.
Okay. So we know that that's part of the picture. It's not that straightforward. And this is, again, as we've both said, we're not here to persuade women to use hormones. But I'm definitely biased. I always say, I'm just right here, I admit it, I'm biased in favor of hormones. And introducing that earlier usually is more effective.
Really good, really good. So you have the miracle of menopause. So you have your own support system.
Yes.
Network support. So if you could share about that, I would love it. And if you have any specific stories, maybe from some of your members that have experienced, their before and afters, we would love to hear. We love stories on here.
Right, exactly. Well, as you are aware, and the people you work with are aware, we, especially as women, we thrive in community. We really do. We just do better when we have that support. It doesn't have to be a big group. In fact, when it's a larger group, it's beneficial to identify a little group within that larger group. Okay.
I like that idea.
Yeah. And so, I'm just thinking of a woman that I've worked with, and she was just really appreciative of, as that you can do in a group, is hear other people's stories and know that you're not alone as you're going through this, because it can be very isolating. At least in the US, we've got this ethos of, I got to muscle through as my own private individual person. My family's from Argentina. So it's not that way there. It's a lot of community, a lot of getting together in groups and in social settings. So that's what I grew up with. And so that's really what that I like to bring to everything that I do when I work with women.
Yeah, I love that. Yeah, we need to do life together. We need to do disease together. I hate to say it, that's kind of a weird phrase, but we do. We got to go through this, this journey of living with the disease, and then women need each other. It is amazing when we do get together, and I like that idea of the smaller. The larger communities are good, I think, to learn from. But those closer, more, I'll call it intimate, but having those few that you can really connect with really does make a difference. I've seen that with the groups I've worked with as well. Most definitely. Yeah. And that just naturally happens. I think we're brought together. There's certain, maybe it's just a different stage, or just something about that time that is very unique to you. And we can find other women that are right there with us. And it's beautiful. It really is. Yeah, it really is when we can find those connections.
Yeah, I call it the miracle of menopause, because with all of the problems that happen and that come up in health and our bodies, it's also a miracle of an opportunity, because mentally it's a whole new stage of life. obviously. Well, it might not be obvious to a woman who's approaching it. I remember I was leading up to my 40th birthday. I was not too happy about it. But then afterwards, it was really good. And same with turning 50. So I'm excited about turning 60. You know, I think back into my younger days where I was really focused on the outside world's view of me versus now it's what am I going to do? How am I going to approach the rest of my life?
Totally agree.
So it's really a special time for us.
Yeah. I appreciate all that you're doing for our community and just getting this really great information out there and coming in here and sharing you and sharing your passion. It's real important. So share where can our listeners connect with you and learn more?
Yeah, absolutely. Yeah.
And I hear you have a book. We'd love to hear about that.
Several books, yes. Yes, I've written several books, but I have one particular as a gift for our audience. And that is this one over my shoulder here. It's called Go for Great, Dr. Liz's Guide to Thrive at Every Age. And it is, it's GREAT is an acronym. So it's gain knowledge, realize the truth about hormones, explore your expectations, advocate for yourself, and thrive. All right. So kind of a fun one, and delighted to give your listeners a digital copy as a gift.
Oh, awesome.
So the link will be, we'll get that link for everybody.
We sure will. Absolutely.
Yeah. My website is the central location for everything that I do. Of course, social media. So we'll be helping each other and get this episode up for everyone on social media. My website connects to everything, including the social media. So it's drlizmd.com, drlizmd.com. I have a newsletter I send from time to time. Access to everything is there. The blogs, the books, there's a lot on there. It's a good central. It's a good central location. Ask me questions, reach out to us. Yeah.
Absolutely. Well, thanks again. And yes, I will link all of that right here in the show notes and definitely have that resource for them to grab and learn from. Again, thanks so much. It's been a joy to get to know you and to spend some time talking about this very important topic that we just need to keep spreading, spreading the truth and the encouragement to feel our best as we're aging. All women, and especially the listeners here, women with type 1 diabetes, because we are here for each other, ladies, and have a beautiful day. We'll see you back in here next week. Thank you for listening to the Type 1 Midlife podcast. We are so grateful for the time that we spent together today. And if this conversation resonated with you, or you just love connecting with others living with T1D, please take a moment to leave a rating and review. Your feedback helps us reach more people who need this community and resources. And if you realize you need more support than you're currently getting, remember you don't have to struggle alone. Visit me at abundanthealthwithmelissa.com for free resources on mastering type 1 diabetes and menopause, and to stay connected and learn about my coaching programs. We look forward to being together next Monday. So make sure you're subscribed so you don't miss a single episode. Remember that together we can age gracefully with type 1 diabetes.